We're joined by Professor Nick Maynard. He's a consultant upper GI surgeon at Oxford University's Hospital's NHS Foundation Trust. And he was in Gaza for just 2 weeks and left yesterday to Cairo, which is where he's speaking to us from. Professor, it's good to have you on the program. The 2 weeks that you spent in Gaza, what was your experience there during this war and what did you see?
Thank you very much for asking me on. As you said, I left Gaza yesterday. I had 2 weeks at Al-Aqsa hospital, which is the only hospital in middle Gaza, serving the camps, Al-Maghazi camp to which you referred, and also Nusrat camps and Al-Baraj camps. So a large population of people. And I witnessed things that I would never have expected or hoped to have seen in a healthcare setting. The overcrowding of the hospital was enormous. There were some days 500 admissions from bombings in the camps I just mentioned. The staffing of the hospital is very low because people have left, and it became much worse last week when the Israeli Defense Force forced many people from mid-Gaza to evacuate to the south, and of course that meant a lot of the doctors went. So we saw the most appalling injuries in many children being killed, many adults being killed, and it was awful, it really was.
Professor, how do surgeons even work in this type of setting? You know, at the best of times, surgeons there didn't have everything they needed pre-war, but now with so many medical medicines and just even tools not being able to get into Gaza, how do doctors actually perform their duty?
With great difficulty. So on many days there was no morphine in the emergency department. So little children were coming in with severe injuries, and there was no pain relief we could give them. In the operating theatres, on one day we had no running water, so we couldn't scrub up. We had to use alcohol gel to try and sterilise our hands. On another day, we had no drapes for the operating theatre, so we were having to use gowns to drape the patients during the operation. The sutures, the stitches we used were, we didn't have the right sutures, so we were having to use the wrong types of sutures to do operations. So they are appallingly difficult conditions under which to do often very major life-saving surgery. And the capacity, the amount of operating theatre capacity was wholly inadequate for the work that came through. So there were many people who died despite having injuries that they could have been saved from. There were patients who clearly could have been saved, but we were not able to because there was no operating theatre space to treat them.
Professor, you've been going to Gaza on and off for the last 15 years. I would imagine that this is the worst that you've ever seen the healthcare situation there. What is the message that you have to anyone watching, especially to your government and to the US government, who are two of the major world powers who have yet to even call for a ceasefire in Gaza?
So there is a mass indiscriminate killing of the Gazan population at the moment. The aid that's going in is welcome, but it can never be sufficient until there is a ceasefire. So I cannot understand why my government in the UK and the US government will not push for a permanent ceasefire, because many more thousands will die. The deaths so far are from trauma, but of course the excess deaths will be many more tens of thousands. There are many diseases that cannot be treated: kidney failure, diabetes, cancer, heart disease. Infectious diseases are becoming rife there. So the amount of deaths will become far, far more than we're seeing at the moment. So the most important message is a ceasefire, a permanent ceasefire, and that is up to the US and the UK governments to put pressure on the Israelis to stop the indiscriminate mass slaughter of the Gazan population.
And Professor, when you speak to your colleagues in Gaza who are Palestinians themselves, who are living through this war and they're living through a trauma that most of us can just not imagine, how are they coping in terms of trying to do their professional duty as best they can in this situation, while also dealing with the emotional trauma that they and their families are going through?
I cannot understand how they are coping as well as they are. The mental trauma, I think, is huge, but they are a quite remarkable population there. The doctors and nurses I have met, and many of them known for many years, are some of the most remarkable and some of the most strong people I've ever met in my life. But the mental health toll will be appalling. One of the doctors I've worked with over the years managed to get out. In fact, I met him in Cairo 2 weeks ago, just before I went into Gaza. And he is a wonderfully intelligent, strong doctor. But he said the first thing he was going to do was find a psychiatrist to talk to, because he was completely shell-shocked by what he's been through. So, all the news at the moment is about the trauma, the bomb victims, the gunshot victims. I've mentioned the excess deaths from other diseases, but the amount of mental health trauma will be vast, and it is just appalling to think how much more they're all going to suffer.
Professor Nick Maynard, it's been really good to speak to you. Thank you so much.
Thank you very much for asking me.